One question that I get asked a lot is, what is the correct ICD-10 code for documentation of coffee ground emesis? So today's ICD-10 quick coding tip will answer this question. My name is Claire and I'm an inpatient coding auditor and educator. In my quick tips and tricks videos, you'll discover valuable insights to help sharpen your medical coding skills and code with confidence. If that sounds like something that would be helpful to you, please consider hitting that subscribe button so that you can be notified whenever I release new content. Coffee ground emesis refers to vomit that resembles coffee grounds in texture and appearance. Gastrointestinal bleeding is a primary cause of coffee ground emesis. So when a patient presents with coffee ground emesis, they're typically evaluated for a possible GI bleed. Because of this, many coders think that documentation of coffee ground emesis is synonymous with blood and vomit and so is coded as hematemesis, but that is not the case. Documentation of coffee ground emesis may not be coded as hematemesis in ICD-10. Even though coffee ground emesis does often indicate the presence of GI bleeding, we are unable to code documentation of coffee ground emesis as hematemesis because there's no subterm in the alphabetic index under emesis or under vomiting for coffee ground. So we cannot assume that this term indicates that the patient is experiencing a gastrointestinal bleed with hematemesis without further provider documentation clarifying the diagnosis. So how should documentation of coffee ground emesis be coded? If GI bleeding is definitively documented elsewhere in the record, assign the appropriate code for the GI bleeding. If the provider has only documented coffee ground emesis, query for clarification. If the provider has only documented coffee ground emesis and a query is not possible, assign R1110 for vomiting unspecified. Let's take a look at some examples. In this first example, according to the H&P, the patient has coffee ground emesis, so treatment was started with IV pantoprazole. The discharge diagnosis is coffee ground emesis, hematemesis due to upper GI bleeding resolved with pantoprazole. In this case, the provider has further specified the coffee ground emesis to be hematemesis, so the code for hematemesis should be assigned. In the second example, according to the H&P, the patient has coffee ground emesis, so treatment was started with IV pantoprazole. The discharge diagnosis is coffee ground emesis resolved with pantoprazole. So in this case, GI bleeding was not definitively documented, but coffee ground emesis is a symptom commonly associated with GI bleeding, and the patient was treated with a medication that can treat GI bleeding. So a query is warranted to further clarify the definitive diagnosis associated with the symptom of coffee ground emesis. The documentation in the third example is exactly the same as in the second example. However, in this case, we're unable to query the provider for clarification. It doesn't happen very often in the inpatient setting that we wouldn't be able to query the provider, but if for any reason a query cannot be made and no additional specificity is found in the medical record to further specify the coffee ground emesis, the appropriate code to assign would be R1110 for vomiting unspecified. So that's it for today's quick tip. I really hope that this video was helpful for you. If it was, please give it a thumbs up. And if there's any topics that you would like me to cover in the future, just leave a comment below and I'll add them to my list. Thanks for watching, and until next time, happy coding.